Remote screening and monitoring of subfertility issues and treatment with OvuSense Pro. Continuous core body temperature measurement. This can predict ovulation in cycle and confirm the date of ovulation, and is clinically proven to be more accurate at doing so than other home-based methods. It's measured using a specially designed sensor that's placed in the vagina overnight. Readings of continuous core body temperature are taken every 5 minutes. Data are then downloaded each morning to a dedicated app, which calculates the best representative temperature for each night. It then displays this on a chart of continuous core body temperature throughout the cycle. Novel clinical research has now led to a clinician version of the OvuSense product called OvuSense Pro. This provides remote cycle pattern analysis in a dedicated clinician portal. It's useful to introduce the OvuSense charts. OvuSense draws 2 continuous core body temperature curves on each chart. The blue line shows the raw, representative overnight temperature values plotted on a daily basis. The green curve shows the smooth weighted average temperature values produced by the OvuSense algorithm. OvuSense uses this curve to predict ovulation up to 24 hours in advance in real time using current cycle data. Moving on to the case studies. The blue shading on the OvuSense charts indicates the day of ovulation. In this case, day 62. So as we can see from this first chart, patient A had some very long cycles with late ovulation. She also exhibited the false start pattern. The pattern repeated in the second cycle. The patient was prescribed letrozole to shorten the cycle and bring ovulation back towards the middle. OvuSense Pro clearly shows the effect of the letrozole with a much shorter cycle and a more rapid rise in temperature around the point of ovulation. Patient B exhibited short luteal phase and successive cycles, along with crash to baseline and late ovulation. The pattern was clear and consistent in cycles 2 and 3, and accompanied in these 2 cycles by crash after ovulation. The patient was prescribed progesterone to help support their luteal phase. The increased luteal phase length and sustained level of progesterone is very clearly shown in the continuous core body temperature pattern. Patient C had a previous diagnosis of PCOS. They had long cycles, some of them very long. After this cycle, they were treated with ovarian drilling. After the ovarian drilling, they were prescribed letrozole. OvuSense shows a very clear restoration of ovulation and a shorter cycle. OvuSense Pro presents an affordable method which helps with remote screening from the moment at which a couple starts to try and conceive, or even beforehand. It establishes clear indications for further testing for the main causes of subfertility and infertility, then helps to remotely monitor treatment, offering a bridge between home testing and clinical intervention.